Hello and welcome back to this series of SYNLAB podcast where we're discussing how to maintain your thyroid health. My name is Patsy Mokungah and I'm still your host. And with me here is still Professor Fasanmade and Dr. Okunowo. So now we're going to be delving into nutrition and thyroid health. I'd like to ask, how does diet impact thyroid health and what nutrients are essential for optimal thyroid function?
Okay, thank you so much, Pat, for that question. There's a lot of things online, a lot of junks online, and telling people to hit this and not to hit this and not to hit it. So, what our advice is that for a person that has a for thyroid function, you just need to eat a balanced and good food. And that will help maintain your thyroid function. So there's no specific food that is used for treatment or prevention of thyroid problems. So eat good food. But some studies have shown that some foods in very, very high quantity.
Emphasis on
Yes, very
high
because of so that people can get it very clearly, can predispose to thyroid dysfunction. So they call them Goitrogens. And yes, so those foods like cabbage, cauliflower, mossweed or sea moss, and
and cassava.
Cassava, yes.
Oh,
yes.
I feel like people will be happy to hear this because it's vegetable.
Yes.
But note that she said in
high,
very high.
so you can eat it.
You can eat it. Oh.
Exactly, you can eat it. Just when it's excessively high. So most times when my patient comes to the clinic, I tell them, eat balanced diet. You don't need to be adding excessive iodine to your food or taking iodine from your food. And most times the daily requirement of iodine for every human being is about 150 microgram per day. So small. And now looking at our staple food, bread, milk, even the semo and the rest, they are all fortified with some small quantity in the normal daily requirement dose of iodine. So you don't really need to start looking for iodine or start putting iodine in your food because you have a thyroid problem or you want to prevent a thyroid problem. So it's all about just eating healthy.
And you don't need to go and get all these supplements.
Yes, all those supplements is not necessary.
Okay.
Yes.
So why is iodine important for thyroid health? Even me that does not know much about thyroid health, like since I was a child, I know that there's a relation between iodine. They go advertise it with iodine salt.
Yes,
you just mentioned iodine
yes.
salt. So why is iodine so important?
So now, one thing we should bear in mind is iodine is not produced by the human body. We take it mainly from the food. So the mineral is mainly from your food. So that's why I said previously there was poor fortification of foods with iodine. And we tend to have a lot of people with goiter, and they call it endemic goiter, which is due to iodine deficiency. And people have more of then hypothyroid, low level of the hormones. So now with a lot of fortification, we don't have so much of those endemic goiters again. So it's been phased out because
endemic just means it was so common
everywhere.
So like before in the past, people had
a lot of
very
common.
And actually it was two reasons. First of all, they didn't have enough iodine in the food, and then secondly, they were taking large quantities of the goiter producing foods, which we call Goitrogens, which she mentioned.
Yes.
All those cabbage, all those cassava, tubers, all of those ones also contributed. So
but
you
that's
had
so much less to do.
Yes, so you had inadequate iodine and then food that was pushing goiters to occur.
That's interesting. But it's like, how could you have inadequate iodine back then? Because you're mentioning things that help they were already in people's diets.
Some soil, some mountainous areas, and some areas, their soil is deficient in iodine. So because it's deficient in iodine, any plant that sprouts up or is produced from such areas have low level of iodine. It's a mineral that you get it solely through what you take in. So when those food people eat from those areas, the iodine they consume is low. And then in those days we don't have iodized salt. We just have normal salt,
But
that
now,
we use. But now everywhere there is iodine salt. So there is more than enough recommended daily allowance of iodine in all our food. So we really don't need a specialized. So now when you take in that iodine and you take it, once you take in, your bowel absorbs it and carries it into the thyroid gland. Once it gets to the thyroid gland uses it for production of hormones, the thyroid hormones. So the thyroid gland uses it to produce the necessary hormones in the right quantity. And so with that, you'll be able to function well. So, but there are some conditions to which when people are not taking enough in those days, that they have endemic goiter, like Prof has also expatiated. But with now that is fortified, you can actually get your iodine from your food, and you don't need an extra buying a particular
okay,
thing.
but I would like to think maybe like that's for regular people. Are there people, if you have endemic goiter, that's it, I've gotten it. So if you have endemic goiter, like, don't you now need extra? Wouldn't that be a situation where you need like extra supplements of iodine?
Yes.
You can now add, because I'm asking like when these supplements, the instances where they become necessary.
Well, what happened was that in the 70s and 80s, when you had a lot of endemic goiter, they looked and found out, why do these people in these mountainous regions have so much goiter? And they found out because of the high elevation, it means they were relatively further away from the sea. Because a lot of seafood, salt water. So a lot of those people had inadequate iodine in their food, in their soil, in their plants, and a lot of them had goiter. So the WHO and other bodies said, what can we do to make sure that everybody, irrespective of where you live, have enough iodine in your food? And they came up with the fact that, well, almost everybody takes salt. So why don't we just legislate that everybody who is selling salt adds a little bit of iodine? So that's where it gets to every community, and that's how they came about the issue of iodizing salt.
So iodized salt is not just a marketing scheme, apparently.
No, it's a health.
Relevant.
Yes,
very healthy.
Very relevant. Yes.
That is very key knowledge.
And when that happened, they found out that the endemic goiters virtually disappeared.
Yes.
Thank you, World Health Organization. I'm very grateful for this. Okay, so what are the major risk factors for developing thyroid disorders?
Well, the risk factors for developing thyroid disorders, they are quite varied. But the first one is the gender, meaning that ladies are about 10 times more likely to develop thyroid disorders than men. You just look at people that you said who have goiters. You find out that most times they are females. So they're about 10 times. So what makes the lady more prone to thyroid? Usually during the reproductive cycle, menstrual cycle, pregnancy, breastfeeding, all those things that are peculiar to the female consume extra amounts of thyroid hormones. So it means you need more. And that is why one of the things that we do also for women who are seeking to get pregnant or have tried is that the physician or the gynecologist will say, go and do a thyroid function test, so that we are sure that
you're functioning
optimally. So the gender is number one.
Okay, so as a female, you are more predisposed to this. Would you say that, like, maybe during your monthly cycle or all of that, you should look for more, thyroid?
What you said actually is something that actually plays out in real life. People that have very small goiters, they notice that at some time during the menstrual cycle, it gets bigger. And then at another time, it gets smaller.
Everybody is going to be standing in front of a mirror after this podcast. I just know it.
Pregnancy,
pregnancy too.
Pregnancy gets a little
bigger. Yeah.
Yes.
I'm touching my shoes. That's so instinctive. I didn't mean it. But wow. Okay, that's very interesting. That's learning a lot. So diet does play a major role. I think in all the health-related topics that I have had the privilege to discuss, this might be the one where diet plays so much of a role, because for the first time I'm learning that externally is where we'll get iodine from, not internally.
Yes.
So eating has to do, but just eating regular food right now is enough, not doing too much.
So regular food is best, but if you want extra from food, then you take more of seafood.
For all the seafood enthusiasts out there, we have been told that we can go forth and prosper. Thank you very much, sir. Thank you very much, sir. All right. So I know that this has been an educative episode on this series. So stay very close to your seats. Don't stand up. Don't go anywhere. While you are staying on your seats, start calling somebody. Tell them that they need to subscribe to SYNLAB Podcast here on YouTube and on Spotify. Tell them to leave a comment, tell them to like, and tell them to also tell other people. We'll be right back with even more educative content.